let us continue our discussion with the principle of intensity. It is important to note that personal experiences to improve realism is one among those advocacy in the principle of intensity. Students learn by imitating and actuating the experience that they learn from the certain situation. So in nursing, pwedeng i-apply yan in the process of related learning experience o yung sinasabi natin na mag-duty kayo sa ospital o kaya sa community. What you experience in that particular situation will be the learning that will be added to your knowledge, skills, and attitude. So in that case, learning is motivated by the acquisition of the experiences in real life situation. Next is emphasizing important points of instruction with gestures, showmanship, and voice. So the voice and the manner how the lecture or the discussion is being given by the teacher will affect the learning of the student, no? So kung mahina masyado yung boses ng teacher, it will be difficult for the student to absorb immediately the point of discussion. Whereas if the teacher speaks audibly, merong convincing ang manner ng kanyang pagsasalita, so mas magandang pakinggan at mas naiintindihan ng mga estudyante ang topic na kanyang ipinapaliwanag. And then make full use of the senses, no? So meron tayong mga important senses, no? Merong mga estudyanteng visual, merong mga auditory learners, no? At meron namang sense of touch, no? Where students appreciate the learning process by merely taking or making use of their senses, no? May mga instances like mga learners natin sa mga elementary or preschool, di ba? Yung mga sizes and shapes ng isang bagay ay natututunan nila at na-appreciate nila kapag hinawakan nila and not by merely looking at it in the picture. So in that case, we can apply that learning process in the hospital setting, for example, in the operating room, ano? So it is important to note na mas matututo ang estudyante kapag pinahawakan at saka real life situation nilang mahawakan yung mga instrument, no? At ma-feel nila yung texture ng mga gamit sa operating room, no? Rather than by just showing it in the picture or in the video. Next is the principle of requirement. It states that we must have something to obtain or to do something. It can be ability, skill, instrument, or anything that may help us learn or gain something. So it is important that just like what mentioned to you earlier, that we must have something to obtain. Kailangan merong madagdag na kaalaman, no? So because learning take place when you acquire knowledge, skills, and attitude. Next is the principle of freedom. It says here that things freely learned are best learned. The more a student is coerced, the more difficult it is for him to learn, assimilate, and implement what is learned. So kaya nga when you are preschool, no, you were asked by your parents, no, do you want to study? And then if you show your urge to study, then your parents will enroll you in the preschool. Same as in college, no? Since we are already adult individual and we have our ability to decide, we were being asked by our parents, anak, anong gusto mong kuhaning kurso sa college? I will support you. So that should be the case, no? Or the ideal case, no? Because you will learn by motivation, no? But not with coercion. Since learning is an active process, students must have the three great freedoms that constitute personal responsibility: the freedom of choice, the freedom of action, and the freedom to bear the result of the action. So in that case, learning will take place without coercing an individual to study on a specific topic, but the ability of the learner to really try to learn by himself, no? And taking freedom of action as well as getting the consequences of the action. So pag nag-aral ka ng ganitong topic, you will learn how to give injection, no? To patients. So pagdating ng panahon na nurse ka na, marunong at magaling ka ng mag-injection ng mga pasyente. So that is an example, no? Sa nursing, when it's applied in our field. If no freedom is granted, students may have little interest in learning. Now, there are three major schools of learning, no? First is the behavioral theory. Second is the observational learning, imitation and modeling. And the third is the cognitive theory. So the behavioral theory, learning takes place when there is a change in the behavior. Now, behaviorism focuses on the idea in which it relates with the environment. This learning theory states that the behaviors are learned from the environment and says that innate or inherited factors have a very little influence on behavior. Now, the observational learning, imitation, and modeling is a type of learning that happens indirectly through a process of watching others and then imitating or modeling their behavior, with the imitating being called as modeling. Now, Albert Bandura is an influential psychologist who first studied observational learning. So in nursing, we can apply this observational learning, no, imitation and modeling, sa ang particular aspect during the skills enhancement, no? Like for example, the one that we are doing in the Vines laboratory, no? Where when we teach the students the skills in nursing. Like for example, the skills in giving intramuscular injection, no? First, it will be discussed and demonstrate by the clinical instructor. And then the students, upon learning how to do the principle of giving intramuscular injection, will try to model and will try to do the actual procedure in giving intramuscular injection through return demonstration. So that is an example of observational learning, imitation, and modeling as applied in nursing. Next is the cognitive theory, learning by thinking, reasoning, and transferring. So, cognitive learning theory uses metacognition, no? Which means thinking about thinking, to understand how thought processes influence learning. So this is the ability of the person to think critically, no? So there are some instances where it is being applied in nursing during the board examination or in any example of the formative assessment that is being used for nursing, no? We usually give situational analysis, no? Where situation in a certain nursing procedure or process is given through an examination, and the student will think critically on what will be the best answer that will best describe or best derive the needs of what is being asked in the question, no? So that is critical thinking, cognitive theory. Next, these learning theories is said to be important in health education because it comes hand in hand with learning and teaching process. So theories are concepts and proposition and fit them together to explain why people behave, act, and think the way they do, and predict under what circumstances they will act. Now, the learning theory is a coherent framework which is facilitated or proposed by a certain theorist which compose of set of integrated constructs and principles that describe, predict, or explain how people learn and change. Example, contiguity theory. Watson and Guthrie emphasize the contiguity of the stimuli and response. So John Watson postulated that behavior is a series of conditioned reflexes, and all emotions and thought is a result of behavior learned after conditioning. So example, when the child is curious, the child will touch the stove, no? And will feel the pain because the stove is hot. Now, the child will not touch the stove anymore, even if it is cold, because the thinking of that child stays in that child's mind that the stove is really hot all the time. Now, there are techniques no, based on respondent conditioning. Number one, classical Pavlovian conditioning. Number two, systematic desensitization. Number three, stimulus generalization. And number four, spontaneous recovery. Number one, classical Pavlovian conditioning is a process which influences the acquisition of new responses to environment stimuli. Systematic desensitization is the repeated and gradual exposure to fear-inducing stimulus under relaxed and threatening circumstances that gives the patient the sense of security that no harm will come so that he or she no longer fears the stimulus. While stimulus generalization is the tendency to apply to other similar stimuli what was initially learned. And the spontaneous recovery is usually applied in relapse prevention programs and may explain why it is quite difficult to completely eliminate unhealthy habits and addictive behavior, which one claim having complete kick the habit. Now, the reinforcement theory of Thorndike and Skinner proposed that the stimulus and response bonds are strengthened by reinforcement such as rewards and punishment. So, for example, the child learns to avoid the stove because the pain was a negative reinforcer. So, in the application to learning, so if for example, if you are very attentive and participative in the discussion, the teacher will give you additional points. But for example, if you fail to submit on time or you submit the output that is needed to be submitted, then you will be given a deduction or minus points to the output that you have submitted. So that is the rewards and punishment principle. Now, according to B.F. Skinner, it focuses on the behavior of the organism and the reinforcement that follows after a response. According to Thorndike theorized that behaviors followed by satisfying consequences tend to be repeated, and those that produces unpleasant consequences are less likely to be repeated. No? Importante na we learn from experiences, and if that experience is not very pleasant to us, then